We've heard the past couple of days something that I guess we happen to hear sadly on a regular basis here, and that's about overcrowding in our ERs. But we're now dealing, of course, not just with COVID. We've been told, of course, the flu season probably will be back this year because people, of course, are not taking the same safeguards they were a year or 2 years ago when COVID was serious, and we didn't see flu because people were wearing masks and washing their hands and doing whatever they could to stay out of crowds. That was then. This is now, and now the numbers are quite concerning. So we wanted to find out more. Dr. Judy Morris is head of the Quebec Association of Emergency Physicians, and she is on the line. Dr. Morris, thanks for your time this afternoon. And let me begin by asking you, I didn't mean it to sound that way, but we hear this kind of thing every year, typically, at some point. Maybe it's just at the outset of the flu season where overcrowding becomes an issue in ERs. Is it worse this year? And if it is, what's making it worse?
Yeah, it's worse. We usually see it only temporarily during a flu season, but now it's been creeping up. We've seen it pretty much every COVID wave in the past 2 years, but now since the summer, it's been the numbers have been pretty high with occupancy numbers that we've never seen across Quebec. And in numbers like over 200% in some emergency rooms, it's unseen, and it's not. We haven't even started the flu season, so that's very worrisome for us on the ground.
So then, Dr. Morris, I'm imagining, you must be pretty worried about what's forthcoming. As you said, we haven't even started flu season. We're in this bad a situation now. How much worse can it actually possibly get?
Well, what's worse is that it's the teams that have been there for 2 years fighting first COVID and now being in these conditions day after day. What we're fearing is all the weight on the shoulders, and at some point people are going to go, that's it, I give up, I leave. And we've already seen that. Healthcare personnel, nurses, being, fed up of working overtime or making up for the lack of personnel or resources elsewhere and quitting. So that's the next step, and that's what we really don't want to go to. We want to try to avoid so that we can keep our expertise, our teams together, and we can offer the care that patients deserve.
Do you feel like the government's been lacking in terms of the messaging that they're putting forth? We are seeing an uptick in COVID cases right now. As you've mentioned, flu season's about to arrive. How do you feel about the messaging we're getting from the government?
We have seen messages in the past and in previous waves, and it has to be as serious. We have to make sure that people protect themselves, make sure they try to minimize the spreading the disease, that they do get their shots. It seems that the vaccine booster has come through as the appointments are going up. But this is important because we cannot afford another wave. We cannot afford to see numbers go up in our hospitals and emergency rooms right now. We just don't have the capacity.
Yeah, which is, of course, part of the other problem here. Never mind people getting sick and flu and COVID converging here. It's the fact that we know there are still, close to 4,000 people out of the system for a variety of different reasons, and really no indication that's going to get any better anytime soon, is there?
Yeah. That's that part is worrisome. We've been hit with surprises after surprise with this COVID wave, and we're hoping it's not as bad, but those numbers are going up again once more, and then we know that it's fall time. People are going more inside. There's less aeration, so all of the measures will help us to prevent the spread.
I was thinking about, as Aaron said off the top, we hear about this every year, or not even every year, seasonally, right? We hear about the ERs being completely overrun and just, hugely over capacity. Yep. And then we hear kind of the same solutions being offered up, and yet they don't really seem to alleviate the situation. Are there real solutions to this problem that we're not taking seriously, that are not really being offered up?
Yeah, and before, when we were facing influenza, there were often short-term solutions. Okay, we're going to put resources to open up a few more long-term care beds, or open up other units, or open up flu clinics. Right now, this seems like it's something that's going to last over time and come back kind of wave after wave. So we have to plan for longer solutions. We definitely have to increase our capacity, our surge capacity. in the healthcare system. So we need more personnel. We need to open up more beds, but we also need to be more efficient at it. There's still a lot of inefficiencies in the healthcare system, and maybe now is the wake up call to say let's get together and work together to have the right patients at the right place and to optimize our resources, because we just cannot create enough personnel, overnight.
Can you clarify, though? Can you detail that when you say there are inefficiencies in the system? And you're kind of giving us an idea of what they are, but what are they specifically? What are the biggest inefficiencies right now as far as you're concerned?
There's tons of inefficiencies in terms of coordination. There's lots of optimization of care that could take place just by having enough support personnel, clerical staff, by having informatics and data access that follows, that helps us do the work, that doesn't slow us down. Sometimes we see one establishment is functioning, but not really taking into account what the other one beside does, or what the other service is doing. There needs to be a lot more coordination in order for us to be more efficient as a whole.
I have to tell you how disappointing and disheartening it is to hear you say that, because I've heard the same kind of thing talked about for year after year after year, yet nothing seems to change. I mean, governments change. They move things around. It's like moving pieces on the board, but nothing changes. Are you at least optimistic that this government will do something? Do you have that sort of sense?
Well, we at least we are moving towards getting the data, and by just moving along and doing our business on our side, we're not moving very very efficiently. But by trying to get access to as much data as we can to see how are patients treated, are they treated adequately? Are we taking too much time to treat someone, or too much resources? Where can we put the resources so that it's we're a little smarter about that. So at least trying to work on getting access to the data might help us go somewhere. We're certainly hopeful, because we have to do something right now given the situation.
I was thinking also how one of the things we always hear is don't come to the ER. Don't come to the ER unless it's absolutely necessary. Go to a clinic, any kind of non-urgent thing. Try to see a family doctor, or go to a walk-in clinic. But is that messaging getting through, or are people still showing up for when they don't really need to be at the ER?
I think, for example, the gap that they're trying to put in place, the message is it might not be going through fast enough. So people do have to call, try to get access to a clinic, to their physician, or to ask an advice with the number 811 to try to avoid the emergency room. But the downside of this is we don't want someone with chest pain or potential heart attack to stay at home and say, I don't want to clog up the ER. So it's always a fine line, but certainly people with more minor problems should try to get either called through the gap, or try calling their family doctor or 811 to try to see if another solution would be possible for them.
I want to ask you one thing that it's kind of a bit off topic here, but we kept hearing this from people we would talk to from time to time, and that's the fact that people who do show up in the ER, there are a lot more short tempers than there ever used to be before for a variety of reasons. Are you finding that?
Yeah. And understandably, if you're going to wait a long time, if you've tried 2-3 places to get care and you end up in the ER and you don't want to be there, people are going to lose their patience. And unfortunately, we've seen patients all across the country, actually, more violence, verbal violence, threats made to healthcare worker, and frankly, that's the last thing people on the ground need right now.
Wow.
Hard to hear that, but as I said, anecdotally, that's what we've been hearing. And you said, when you're waiting all day to get seen, 8, 10, 12 hours, and we've heard stories like that as well. I don't want to say it's understandable, but I think you have to realize that people on the floor are doing the best they can with the resources they have.
And you're going to add to their burden and their burnout. Yeah.
Because the last thing, what everyone wants on the ground is to be able to give the care patients deserve, and it's as tough for caregivers to see the situation and not be able to help patients, or to be overwhelmed. So they're going through tough times as well.
No question. Dr. Morris, thank you so much for your time. We appreciate it.
You're welcome.
Dr. Judy Morris, head of the Quebec Association of Emergency Physicians, and describing the situation there. Doesn't that kind of boggle your mind, though? to hear someone talking about inefficiencies and think, how long have we been talking about this? It started, remember, during COVID at the beginning when data was being transmitted by fax machine?
Yeah.
Because the system is so outdated and has never sort of gotten to the point where it was going to be kept up. That investment was never made.
I think what blows my mind is how many different governments have been talking about this.
And managed apparently to achieve very little.
It's generations now.
Wow.